This is Abia COVID-19 update.
Abia COVID-19 update.
International travelers from some specific countries who are COVID-19 positive have been making their way into the country by presenting fake PCR results. That, according to the national coordinator of the task force, Dr. Sonia Aliyu, and he disclosed this in the response to the Joint Senate Committees on Health and Aviation on the testing procedures following the reopening of the international airspace. And according to him, in one instance, up to 40% of the passengers in a single flight tested positive for COVID-19, despite having tested negative before boarding from their respective countries. Consequently, Dr. Aliyu said an adjustment has been made to the validity period of PCR test to be presented before boarding from 7 to 4 days. And I told you yesterday, if you can remember on this program, how we need to be careful now that we have the international flights. Of course, we have planes coming in, bringing people from outside the country, and we have a second wave in some of these countries. On its part, the Senate said it is worried about how low number of laboratories in the country, and the Senate promised that the request for 52 laboratories will be made in the 2021 budget. And after about 5 months of being on lockdown due to pandemic, international flight resumed at the Murtala Mohammed International Airport in Lagos. That was on Saturday, and the first flight arrived from Lebanon at about 2:30 p.m. and the passengers did not disembark in the usual way. They went through the finger and they were bashed in 20s into the port of entry in line with the federal government's COVID-19 protocols. Welcome to another edition of the program. It is Abia State COVID-19 Update, the third edition for the week. It's midweek, the 16th day in the month of September 2020. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19 as well as the state governor's efforts in ensuring that the state is safe from the virus. This program is running simultaneously every weekday, Mondays through Fridays, on several radio stations in the state, live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Well, let's look at the figures now. As usual, there are nearly 30 million coronavirus cases worldwide, with 29,734,148 confirmed so far. The number of deaths at 939,289, and recovered cases at 546,862. COVID-19 has spread around the planet, sending billions of people into lockdown as health services struggle to cope. And as the possibility of the second wave looms over the continent, people have largely gone back to work and school. India's total coronavirus cases passed 5 million this morning as the pandemic extended its grip on the vast country at an ever faster rate. But let's go straight to the discussion today. I'm going to bring you up to date on some of the development across the planet and also in Nigeria. We have joining us this morning the Honorable Commissioner for Information in Abia State, and also he's the member of the Interministerial Committee on the Control of COVID-19 in Abia State, the committee set up by the Governor, Dr. Okezie Ikpeazu. We have the Honorable Commissioner, Chief John Okiyikalu, in the studio. Good morning to you, Honorable Commissioner.
Good morning, Michael. Good morning, wonderful people of Abia State.
Great to have you in the studio this morning. You're using your face mask. It's very nice, but we have majority of Abians throwing caution to the wind, and we have second wave. In fact, Israel will be going through to lockdown. The country will be locked down from Friday. And we have second wave. We have the international resumption of international flights in the country. I don't know how you want to react to this, as we're ensuring and we'll keep sensitizing Abians on how to keep staying safe.
Yeah, thank you very much. If you are looking to find my personal attitude to this whole thing, you will find that located in Ometraburu.
Okay.
Ometraburu means that whatever you do, you will bear the consequences of that. If you put it the other way, it is at that time that everyone should take personal responsibility for his or her protection. For me, it doesn't matter whether others are wearing face masks or not. What matters is that I want to be safe. I want to be safe from the virus so that my family will be safe from the virus. The elderly persons living with me will also be safe from the virus. And I understand the competition between life and livelihood that is at play globally. You know, people are worried that while they are trying to live and survive COVID-19, that their means of livelihood would have been disappearing and all that. Hopefully we also understand that we can manage both together. You can go to work safely, you can do your business safely wearing face mask, insisting that the other person is wearing face mask.
So we're adapting with the new normal.
Exactly. Adapt to the new normal and then still be able to live your life. We will get to that point where somebody should consider, maybe when we fully open clubs, that you can actually go to a club wearing face mask.
Dancing with the face mask.
Dancing with the face mask.
Okay. Now that we have the rate of COVID-19, the number, the cases, the numbers are declining on a daily. I want to ask you, people are asking now, we want to know how much the government has spent on COVID-19 now. I understand that to conduct test on one person, it costs about 40,000 naira. That's the amount of money it costs. And but people want to know how much has been expended on this COVID-19 and how much especially the state government has used in taking care of Abians and of course to fight COVID-19.
Thank you very much. As an administration, we insist on transparency. More than a week ago, we launched a detailed information on Abia State website, www.abiastate.gov.ng.
Okay.
And we posted there details of every kobo received and every kobo spent. So far, we've spent in terms of the cash component of what was received by the committee. And now that cash component did not all come from the state government. Some came from donations received from individuals, and then part of it is what we received from Abia state government and then from local government that also donated. We spent less than 750 million on the whole intervention.
And
so far.
You got the funding from the federal government?
Not yet, not within the accounting period, but we understand that there is likelihood of some funding coming in, and maybe it has already come in. But within the accounting period, as at August 1st,
okay,
that wasn't in our books. The support we received from the federal government was largely in terms of materials given through NCDC. We listed everything that was received, listed where they went to, every single place we sent palliative to. You will have that listed in that report, and a version of it is expected to be published in our newspapers. Okay. Any moment from now, as soon as we are able to do the needful.
This is very important to allay the fears of Abians. You know, at the start of that pandemic, many were saying it's a way the government wants to make money. There is nothing like COVID-19, and some are still saying that. So when we check the books and let us see what is happening, at least that will show transparency.
Thank you very much, Michael. Please, any Abian that is interested in finding out how much and how we spent the money that was designated for the COVID-19 intervention, please go to our website, www.abiastate.gov.ng, and you will see the detailed report, and from there you can now make up your mind. But the fact is that we thank God that Abia State is rated among the best responders to this pandemic. Like you are aware, in August 2020, Abia State conducted the highest number of tests in Nigeria. Yet, if you look at the outcome, the results that you are seeing today, in the southeast, we are a distant third in terms of confirmed cases. And if you look at the survival rate in our facilities, it's second to none in Nigeria. We thank God. And by tomorrow, Governor Kezi Ikpeazu will be in Abia to commission a brand new infectious disease hospital, which will not only support the fight against COVID-19, but will also prepare for the next pandemic that will come. Assuming this
We're praying there will be no pandemic anymore.
It is our prayer, but it is usually laboratory estorare. To work is to pray. Even while you are praying, you should also prepare, because it is the same God that will give you the intelligence to prepare and to make your handwork successful. And that was exactly the point Governor Ikpeazu made at the beginning of this pandemic. He said, we believe that we are God's own people, that God will help us. God will give us the energy, give us the brain, give us the direction, the way we should go. And because God heard that prayer, if you look at the predictions that were made by all kinds of people before now, they say, many people will die in Abia. There was one came in Oluloye that said, dead bodies will be showing up in Abia everywhere. Today, dead bodies are showing up, unfortunately, in her own state, but none is showing up in Abia, because Jehovah is faithful. The governor and the government dedicated the fight.
Let's talk about the gains achieved. No doubt about it. Abia State achieved some feats concerning the control of this COVID-19. In fact, the governor contracted the virus and was medically treated against all odds, because many persons were predicting otherwise for the governor. But how will the government sustain the feats achieved concerning the gains made on this pandemic in Abia State?
One thing nobody can ever take away from us is the fact that we have some of the best medics in the world, and they have all been trained properly, those who volunteered, on not just how to handle this particular pandemic, but how to handle infectious disease in general. We now have more capacity when it comes to infectious disease management. Before now, we were largely managing infectious disease using the limited capacity that was available at FMC, where we had a 4-bed isolation facility, and very few were coming near those people for obvious reasons. But now we have increased capacity, both in terms of training and in terms of fiscal resources. There are now permanent isolation facilities in Amachara, in Abia, and then there is something I used to tell people. We prepared for the worst. God gave us the best. As of today, there are about 100 base spaces fully equipped with all kinds of gadgets in Umuahia, in Amachara, that has not been used for one day. Not even for one day. And we have about 50-something base spaces in Abia that we have never deployed. And all these are coming with all kinds of equipment fitted into every bed. And what do people celebrate too much? Ventilators. We've not really deployed them in the course of this fight. They have not been necessary, even though we have them. But the other facilities, other equipment that the governor provided, they have been very useful. Now, as a result of this, we now have classic, modern testing facilities in Umuahia and Abia. At the Amachara facility, you have a gene expert equipment and a PCR equipment working together to test our people. Beyond testing for COVID-19, you also use that to test for other diseases. Now, we now have at Abia the laboratory that the governor will commission tomorrow. That laboratory is the only place in the southeast, I know for sure, and south-south, I know for sure, that you will find a 16 modular gene expert equipment. The most that they have is 4 models.
Yeah, just like the one
you saw yesterday. And congratulations to Baby Boo, Chairman Kwanta, for coming out negative yesterday. But you see, people don't appreciate some of these things the governor is putting in place. In addition to that, the governor is set to launch a mother and child hospital in Abia and another one in Umuahia. The equipment left Atlanta, Georgia, about 2 weeks ago. We have videos and photographs. We're expecting that in Abia. And at the end of this intervention with regards to this pandemic. We expect to have radical improvement in terms of capacity to deal with medical challenges, and in terms of equipment and human capacity. We think that a lot of improvements have happened. And if you look at the cost of our intervention, please go back and look at what we've posted. It is actually the cheapest in the whole of our region. And I'm talking about the old East Central State, which is Southeast and South. If you look at the cost, and I want to use this opportunity to thank all those who donated money, equipment, and all kinds of resources. I don't want to sit down here and name them one by one. The government appreciates. We are going to do further publications in newspapers for people to see that these are the angels in Abia that supported this intervention. We also appreciate Abia State government for the resources provided by the governor. Apart from providing the leadership, the governor made sure that we never at any time lacked one kobo. Even while he was battling with COVID-19, he was calling to ask, where are we? Are you protecting the people of Abia State? Is there anything you need to protect these people? And he was giving us the resources. And I listened to Dr. Ijeoma Nduka the other day. She said there has never been anything they asked for that the governor didn't provide. I listened to Dr. Caroline Iwoha, the immediate past NMH chairman. She said the same thing. That should tell the people that they are blessed by God to have Dr. Okezi Ikpeazu as their governor.
Okay, COVID-19 practically affected all sectors. Economy, education sector, just name it. But as it stands now, we have issues with the education sector. The schools are yet to fully reopen. Some states have started calling back their students and their teachers to return to classrooms, but we're yet to see that in Abia State. So how soon are the students, Abia State students, returning to school, returning to classes?
First, we want to thank God Almighty that the exit class students that came for examination, we have not reported or we've not found any single case of COVID-19 among any of them or their teachers. We thank God that they are all safe so far. Now, what we want to do is, again, to look at the measures that will need to be put in place for us to safely reopen our school. We don't do copy and paste in Abia. We don't copy what others are doing. We do what we review and we are convinced will work for our people. And then we'll bring the stakeholders again. We'll bring all the parents, teachers association, the teachers themselves, the clergy, the business community, and everybody will decide, is it safe to bring back all our children? If we all determine that it is safe, we will make an announcement. We are not going to make an announcement because somebody is making an announcement. That person that is making an announcement does not have school children that have come first in WAEC back to back for 4 years. We do. We have the best school children in the whole of this country. So we take extra measure to protect them.
All right. I would like to get reactions from the phone lines, one or two calls before we wrap up today's edition of the program, Abia State COVID-19 Update. And I told you I would tell you some of the issues, development across the world. Around 872 million school children. That's about half of the world's student population are still unable to attend schools in person because of the pandemic. That's according to the executive director of UNICEF, Henrietta Fore. And she said schools had closed their doors in 192 countries at the height of the pandemic, sending 1.6 billion students home. 0808 182 6949, 0811 605 2949. Also drop messages on 0906 510 8289. Abia State COVID-19 update. And yesterday, the number of daily COVID-19 infections in the country fell below 100, making a sharp decrease from the 192 cases reported on Monday. All right, let's take this and see who is on the line. Hello, good morning to you.
Good morning.
You're welcome.
Yeah, how are you?
I'm fine. What's your name?
Yeah, good morning, Commissioner.
Good morning.
Yeah, my name is Timda Chikeze. I'm calling from Umaya.
All right, quickly, you have 30 seconds, please.
Okay, I want to refer to the Commissioner, please.
Okay.
So I want to ask you a question, please.
Go ahead.
Well, for the payment of the civil servants, well, they claim that the governor for paying of the civil servants, but the civil servants are complaining of their salary for payment plus the relation of open of schools. All students are complaining, but in the issue of this COVID-19, but I want the Abia State, I want the governor himself to plan to do that. The school will be open, but all the teachers and all the students will put on face masks.
Okay, what is the question? I'll be very specific. What's your question? Is it a contribution?
I said that I want for paying of civil servants, but the civil servants are complaining that the government.
All right.
I don't know. I don't know who you call civil servants, because I am aware that more than 70% of the state workforce are those in our ministries, departments, and agencies, and I am aware personally that they received their August 2020 salary before the end of August. So when you talk about payment of civil servants, I like people to be specific. If you are talking about those within the local government system, say so that we will know how to solve the problem. If you are talking about workers in our parastatal, say so. If you are talking about teachers, say so. So I don't know how to address generalization, but I want to assure you that this government will continue to do whatever is necessary to take care of all segments of Abia society, both those who are receiving salaries and those who are traders that want to receive good roads, and those who are artisans that want to receive security. We will deploy resources to make sure that the best interest of all Abians continue to be taken care of.
All right, thank you very much, Honorable Commissioner for Information in Abia State, Doctor. I always call you doctor. I don't know, maybe you should start working towards getting your
As
PhD.
a native doctor, yes. No. Native doctor.
Chief John Okeyekale. And that's it on the program this morning, Abia State COVID-19 update. Keep staying safe. It is very important. Join us tomorrow on another edition of the program. My name is Michael Oni.
Says Abia COVID-19 update.
Abia COVID-19 update.